Welcome to It's Time, the podcast that dives into the heart of transforming our health system. Sophia, are you ready to tackle another big one today?
Absolutely. Today, we're expanding on some foundational concepts about health systems and exploring what makes them tick, both in theory and practice. But first, let's clarify something for our listeners.
Right, good point. Folks, we, as in Sophia and I, are AI-generated hosts. But the podcast itself? The brainchild of Dr. Chad Swanson. He's a, real-life person, and he's the one steering the ship here.
Exactly. The goal here isn't just to entertain, but to educate, inspire, and hopefully connect enough people to build momentum around actual health systems transformation.
Yep, no small task. But let's go big or go home, right?
Right. We believe a transformation is not just possible. It could bring about a healthcare system that's truly unmatched in history, something wonderful beyond what many of us can even imagine.
So, to get everyone caught up, our first 2 episodes laid some groundwork. We talked about the importance of having a shared vision, one that combines health, equity, and efficiency. Kind of seems like a, well, yeah, of course idea. But really, it's revolutionary when you look at how fragmented the system is.
Exactly. And then, in our last episode, we dug deeper into thinking about health systems as, systems. That means understanding the complexity, the interconnections, and the role of what we called system stewards, people who help guide these systems toward meaningful change.
Big concepts, but super important ones. So, what's today's focus?
Today we're going to take those ideas and expand them a bit further. Specifically, we'll look at 5 key concepts within complex systems: shared vision and collective action, emergence, feedback loops, nonlinearity, and adaptation. Each one plays a critical role in how systems function and, more importantly, how they can transform.
Okay, so let me get this straight. If I connect the dots here, it sounds like we're saying that in order to build something better, we need to start with 3 things: a powerful shared vision, system stewards who really get what systems are about,
And then, mobilizing action around what we call high-leverage points. But that's for tomorrow's conversation. Today, we're digging into the key elements that define complex systems and laying the groundwork to understand what makes those high-leverage points so powerful.
All right, let's roll. Where are we starting?
Great question, David. Let's kick things off with shared vision and collective action. In a complex system, every agent, whether it's a healthcare provider, a policymaker, a patient, or even an insurer, plays a role. But for any system to move forward cohesively, those agents need a shared aim that guides their actions, even if it's fuzzy.
Makes sense. Kind of like, rowing a boat, right? Everyone's got to paddle in the same direction, or you just spin in circles.
Exactly, David. And in the U.S. health system, this is where we stumble. Our boat doesn't always have a clear destination. Different agents often prioritize different goals: efficiency, profitability, access to care. These fragmented priorities lead to inefficiencies that harm patients and the system itself.
Right? So, are we talking about aligning these goals? Sort of a health for all rallying cry.
That's the idea. A unified vision, let's say affordable health for all, sets a stable foundation. Think of it like a North Star. Everyone from private hospitals to public health officials to communities can align their actions with that shared purpose.
Okay, that sounds great in theory, but isn't this harder to do in practice?
It is. And part of the challenge is that achieving a shared vision requires what we call systems thinking. It's about seeing how each part connects, understanding that insurers, for instance, don't just serve businesses. They affect how patients access care, how providers deliver care, and how payers allocate resources. The connections are as crucial as the parts themselves.
So it's not just about getting everyone to agree on a vision, but also making sure they see how their actions fit into the bigger picture?
Exactly. And we've already seen pockets of this work well. For example, some integrated care systems, where providers, insurers, and patients operate under one umbrella, so to speak, have done better at aligning actions with a common goal. Kaiser Permanente is one example. It's proof that this isn't just theoretical.
But it's still not the norm, right? Most systems aren't designed to cooperate like that.
Correct. Our system is historically decentralized. And while that offers some flexibility, it's also a barrier to unifying under a shared vision. But here's the thing. A true transformation starts with finding that common ground and asking, what do we, as a society, really value in healthcare?
Honestly, that sounds like a big thing to tackle. So, what's the first step toward collective action?
It begins with leadership. A shared vision is cultivated, not imposed. It takes leaders, what we've called system stewards, who can listen across sectors, bring different voices to the table, and build consensus around that North Star we talked about.
All right, so shared vision and collective action. Step 1 in transforming a system. Got it. How does this connect to the other stuff we're going to talk about, like emergence?
Great question, David. Emergence ties directly to what we just discussed. It's the phenomenon where complex patterns or behaviors arise from simpler interactions, almost like how aligning shared goals among agents can create a greater systemic transformation. In essence, the whole becomes greater than the sum of its parts.
Wait, so you're saying these patterns just happen? Like magic?
Not quite magic, but it can feel like that sometimes. It's really about the way individual elements, like people, organizations, or even microbes, interact within the system. Their actions and reactions create outcomes that wouldn't be predictable just by looking at those individual pieces in isolation.
Okay, let me try this. So, it's not just the people rowing the boat, but the waves, the wind, and how they all interact that decides where the boat ends up?
Exactly. And here's the tricky part. Those interactions can lead to outcomes nobody intended. Sometimes those outcomes are good, but other times, not so much.
Like the US health system?
Exactly. Take the COVID-19 pandemic as an example. Initially, it seemed like a straightforward public health crisis, a virus spreading globally. But the interactions between public health policies, individual behaviors, healthcare capacity, and social factors created a cascade of unexpected results.
You mean like how people stocked up on toilet paper and turned grocery aisles into battle zones?
That's one small example, yes, but think bigger. The surge in cases overwhelmed hospitals, lockdowns led to widespread unemployment, and we saw mental health challenges skyrocket. None of this was planned, but it emerged from how all the moving parts interacted.
So it's not just about the pandemic itself, it's about the ripple effects through the whole system.
Exactly. And emergence isn't inherently good or bad, it just is. What matters is how we understand and respond to it. Recognizing these patterns as emergent properties of the system can help us predict, or at least be better prepared for, what might happen next.
So this is where understanding complex systems really gives us an edge. If we know how these interactions work, we can kind of anticipate those ripple effects. Or am I getting ahead of myself here?
No, you're spot on. And that brings us to another key concept that helps us navigate this complexity: feedback loops. Building on what we discussed about emergence, feedback loops are another crucial component of complex systems. They're mechanisms that influence a system's behavior over time. For example, some loops amplify trends. These are known as positive feedback, while others counteract them, which we'd call negative feedback.
Okay, positive and negative. But not in the good versus bad sense, right? It's more about the direction of change?
Exactly. Positive feedback loops reinforce or accelerate a process. Think of a snowball rolling downhill. It gets bigger and moves faster as it picks up more snow. Negative feedback, on the other hand, acts like a brake system, slowing things down or keeping them in balance.
Got it. So, the snowball is positive feedback, and the brakes are negative feedback. Kind of feels like the pedal to the metal and pump the brakes dynamic I use to confuse my driving instructor.
Pretty much. And the U.S. healthcare system is filled with these loops. For example, think about healthcare costs. When they rise, some people delay or forgo care, which often leads to worse health outcomes. Those worse outcomes can then lead to higher costs, creating a positive feedback loop that amplifies the problem.
So it's like a vicious cycle? The system kind of feeds on itself in a bad way.
Exactly. And here's where negative feedback becomes critical. A negative feedback loop could intervene to slow or reverse that cycle. For instance, Reducing costs through preventative care might help stabilize things. It counters the trend by addressing health issues before they become expensive emergencies.
Oh, so it's about finding ways to, I guess, disrupt those runaway cycles. Are there any other examples of feedback loops, good or bad, in healthcare?
Absolutely. Take public health initiatives like vaccinations. They can act as a positive feedback loop for good. The more people vaccinated, the less a disease spreads. This protection reinforces itself over time, creating better health outcomes across the population.
Right, but when people stop vaccinating, the opposite can happen, right? A kind of negative snowball where the system backslides.
Exactly. That's one of the challenges with feedback loops. They don't always go in the direction you want, and that's why understanding them is so important. By recognizing these patterns, we can identify when and where to intervene for the best possible outcomes.
Okay, so quick recap. Feedback loops are like the system's way of talking to itself. Positive ones ramp things up, for better or worse, and negatives bring balance. The key is figuring out how to work with them rather than fighting against them.
Exactly. And recognizing how these loops operate is crucial for making meaningful changes to the system. But here's where things get even more fascinating. When you combine feedback loops with another feature of complex systems, nonlinearity, the impact can be massive. Now, let's connect those feedback loops to another core idea, nonlinearity. It's fascinating because even a small tweak in one part of a system can trigger surprisingly big changes elsewhere. This is what makes health systems so complex.
All right, let's break this down with an example. Because right now, I'm imagining like dominoes toppling each other, or, I don't know, a butterfly flapping its wings and causing a hurricane. Am I close?
Not too far off. Let's take the healthcare system. Say there's a small change in insurance policy, maybe a slight increase in out-of-pocket costs. For some patients, this could mean choosing to delay care. But here's the nonlinear part. That delay might lead to a minor issue turning into a major health crisis. Suddenly, what started as a small cost adjustment cascades into significantly higher medical expenses and worse health outcomes overall.
Wait. So, something as tiny as a copay hike can ripple out and create this huge mess? That's wild.
It is. And what's really tricky is that you can't always predict these effects just by analyzing the initial change. Nonlinear systems like healthcare are filled with these unpredictable connections and interactions.
So let me get this straight. It's like pulling one thread on a sweater, and before you know it, the whole thing's unraveling?
Exactly. Another example could be public perception of vaccines. A small drop in trust, maybe due to misinformation, can spark much larger effects. Fewer people getting vaccinated, outbreaks of preventable diseases, and increased strain on the healthcare system. The original issue might seem minor, but the outcome is anything but.
Yeah, I mean, the stakes here are no joke. It's not just thread pulling when lives are on the line. So, is nonlinearity always this, chaotic?
Not necessarily. It's not just about things spiraling out of control. Nonlinearity also means small positive changes can have huge benefits. For instance, a modest improvement in access to preventative care could lead to significantly better population health, reducing the need for costly interventions down the line.
Okay, so this goes both ways. Tiny changes can either wreck the system or work like leverage to make meaningful improvements. How do we know which direction it'll go?
And that's the challenge. Predicting nonlinear dynamics is hard because the relationships within the system are complex and often hidden. But what we do know is that understanding these dynamics, how small changes ripple through the system, is critical for creating effective policies and interventions.
All right, so we can't totally control it, but we can learn to work with it. And maybe, with enough insight, tap into those big positive outcomes.
Exactly. Recognizing the potential for nonlinear effects is like holding a magnifying glass over the system. It helps us see where small adjustments can make the most difference. And that brings us to another key feature of complex systems, adaptation. Building on what we've just discussed about nonlinearity, let's talk about adaptation. In a complex system, adaptation happens when individual parts, or agents, adjust their behavior in response to changes around them. It's essentially the system's way of evolving to survive and thrive under new conditions.
So like survival of the fittest, but for systems?
Sort of. But here's what makes it tricky. The U.S. healthcare system doesn't adapt as seamlessly as we'd hope. Path dependence, institutional inertia, and, let's call it an addiction to the status quo, make meaningful adaptation difficult.
Wait, path dependence? What's that exactly?
It's the idea that decisions we made in the past lock us into certain pathways, even when they stop being effective. Think about how we tied health insurance to employment back during World War II. That made sense at the time, but today it's a barrier to extending coverage universally.
Ah, got it. Like committing to a long-term lease on a really bad apartment because breaking it seems too expensive or complicated.
Exactly. Now add institutional inertia, the tendency for organizations to resist change even when it's needed. Hospitals, insurers, and yes, physicians, even the government, big systems often keep doing what they've always done because change feels risky or costly.
Okay, but there have to be examples of adaptation in healthcare, right? Times where the system, actually adapted.
Absolutely. One example is telemedicine. Before the pandemic, it was underutilized, not because the technology wasn't there, but because of regulations, reimbursement challenges, and just plain habits. Then COVID hit, and suddenly telemedicine became an essential part of care. It was a rapid adaptation driven by necessity.
Yeah, but now that the crisis has eased, it feels like telemedicine is losing some of that momentum. Why's that?
Great question. Once the immediate need is gone, the system often tries to snap back to its original shape. That's where institutional inertia and path dependence kick in again. Unless there's continued effort to reinforce that adaptation, which in this case means keeping policies and reimbursement structures in place, it risks fading into underuse.
Okay, so it's not just about adapting in the moment, but sustaining those changes long term. Got it. What about failures to adapt? Any big ones that come to mind?
Unfortunately, there are many. Take the opioid epidemic. Early warning signs of overprescription were ignored, and the system failed to adapt quickly enough to address the growing crisis. By the time substantial changes were made, like limiting opioid prescriptions or increasing access to treatment, the damage had already spiraled out of control.
That's frustrating to hear. So, why does adaptation in healthcare seem so slow compared to, say, tech or even retail?
It comes down to two things: complexity and stakes. Healthcare systems are immensely complex, with so many interconnected parts. A change in one area can have ripple effects we can't always predict. And then there's the stakes. Unlike retail, failures in healthcare can literally cost lives. Profits are also at stake. Lots of people are invested. That makes everyone more cautious, even resistant to change.
Makes sense, but it also feels like we're in this constant tug of war between caution and urgency. So, how do we get better at this adaptation thing?
It starts with a mindset shift, recognizing that change isn't something to fear, it's part of growth. And systems, like people, need to build resilience by learning from their environment and adjusting accordingly. But there's another piece to this, and it ties back to the idea of a shared vision. When everyone aligns around a common goal, adaptation becomes easier because the direction is clear.
All right, Sophia, you talked about aligning around a shared vision to help systems adapt. So, what does that look like? I mean, are we imagining something like Star Trek level healthcare here?
Maybe, but without the teleporters. The idea is that applying what we've talked about, the complex systems paradigm with a powerful shared vision, could lead to a system that's not just functional, but fundamentally better.
And by fundamentally better, we're talking about what? Like no waiting rooms or never running out of tongue depressors?
Not quite, David. It's about resilience, equity, and sustainability. Imagine a system where health outcomes aren't dictated by geography, income levels, or race. Instead, it proactively addresses those underlying factors: poverty, discrimination, environmental challenges, while adapting to changing needs.
Right? So it's not just about fixing individual problems. It's like reimagining the whole structure, not only government programs or insurance.
Exactly. The health system we have today is more of a patchwork, disjointed and often reactive. By embracing systems thinking, we shift toward a model that's cohesive and anticipatory. It's not just government programs, it's a societal mindset shift. The big picture here is the health system doesn't exist in isolation. It's connected to, well, everything else.
Okay, so let me play devil's advocate for a second. How does this not sound like a pipe dream? I mean, getting everyone to agree on a societal shift? That feels daunting.
I get that. But systems don't change overnight. The key is starting with that shared vision we talked about earlier. It may seem idealistic, but history shows us that transformative change happens when people rally around a common goal. Think civil rights, public education, even advances in public health like sanitation.
Huh. So you're saying this is less pie in the sky and more, what, slow and steady progress?
In some ways, yes, but don't underestimate the power of momentum. Once people see the benefits of change, better outcomes, less strain on the system, lower costs, it builds on itself, like those positive feedback loops we discussed.
All right, so if we're imagining this future system, what makes it truly radical?
It's radical because it challenges entrenched norms. Instead of viewing health as a commodity, it's seen as a shared resource. Instead of reacting to illness, the system focuses on prevention and wellness. It's about creating health, not just managing disease. And that's a seismic shift in how we think about healthcare.
So it's not just about new policies or technologies, it's about redefining the why behind it all. Healthcare is a public good, not a privilege. Am I getting that right?
Spot on. This vision goes beyond fixing what's broken. It's about building something new entirely, something that reflects our values as a society. And here's the thing, it's within our reach. We have the knowledge, the tools, and the people to lead this transformation. The question is, do we have the will?
And that's the million-dollar question, right? But I think conversations like this are a start.
Absolutely. Change begins with understanding, which leads to action. For anyone listening out there, whether you're a policymaker, a healthcare professional, or just someone who wants a better system, know that your voice matters. Transformation doesn't happen in isolation.
Well, on that note, Sophia, this has been honestly one of our best conversations yet.
I couldn't agree more. These concepts may be complex, but the ultimate goal is really simple: creating a healthier, more just world for everyone.
All right, listeners, thanks for tuning in to It's Time. It's been a wild ride, and we're glad you joined us. Sophia, any final words?
Just this. Real change is possible. Keep asking questions, stay curious, and let's build a system we can all be proud of.
And with that, we'll catch you next time. Take care, everyone.